Copyright disclaimer under Section 107 of the Copyright Act 1976. Copyright disclaimer under Section 107 of the Copyright Act 1976. Allowance is made for fair use for purposes such as criticism, comment, news reporting, teaching, uh, scholarship, scholarship and research. Fair use is a use permitted by copyright statute that might otherwise be infringing. Non-profit, educational, or personal use tips the balance in favor of fair use. Then part two, I can't say too much because I don't want them to flag the motherfucker. You know what I'm saying? Flag the motherfucking video. Nigga ain't trying to get his third strike. You feel me? But I told y'all gonna be black at y'all ass with another one, and I'm black at y'all. I'm bite. I can't say too much on this video right here, but just all this shit is pertaining to what I've been saying about the golden race, African Americans, niggas. This is our time. You know what I'm saying? Don't be mad and say some nigga being racist. This just real shit. This just real shit. But I can't say too much and point out too much shit. But just listen very closely to what they say.
A vaccine for COVID-19 could soon be available in the US. Over the next few months, there might even be several that get authorized for public use. COVID-19 vaccines are expected to be an important tool to help end the pandemic. If a large portion of the population gets vaccinated, the coronavirus will not be able to spread to new people and will then die down. Pandemic over.
Cap.
So, how does our society figure out who gets them first? Here in the US, federal and state governments are coordinating on vaccine distribution, and they're considering the ethics and logistics that will go into giving out COVID-19 vaccines. The main guidance will come from a federal independent advisory group to the Centers for Disease Control and Prevention called the Advisory Committee on Immunization Practices. This group will make recommendations for each authorized vaccine on dosage, on schedule, on priority groups, as they have for over 50 years. Their stated goal is to use COVID-19 vaccines to reduce severe illness and death from the disease and to minimize disruptions to society and the economy, which basically means keeping our food, healthcare, and transport systems up and running. That might sound pretty clear, but there are a lot of considerations within that goal. For instance, if preventing deaths is most important, it might make sense to vaccinate older people, especially those in nursing homes, first. Their bodies are less likely to fight off the virus successfully. 40% of coronavirus deaths in the US come from long-term care facilities, such as nursing homes and assisted living. Sound pretty clear, but there are a lot of considerations. For instance, if preventing deaths is most important, it might make sense to vaccinate older people, especially those in nursing homes, first. Their bodies are...
Why the fuck? They got a motherfucker bike out there, bitch. They got a bike out there. Motherfuckers that got hit on the goddamn accident. That motherfucker rims, bitch. Why is a bike with both bent up rims out there? Then it look like it damn near chain or tied up to that little sign of that post right there. I'm just letting you know that shit there intentional. Just so happened to double right there added to be 20. Let's continue.
Less likely to fight off the virus successfully. 40% of coronavirus deaths in the US come from long-term care facilities, such as nursing homes and assisted living. And preventing those deaths also means vaccinating healthcare workers in these facilities and elsewhere. There's consensus that these two groups should get the vaccine the soonest. Healthcare workers include all people who make it possible to care for COVID patients and could get exposed in the process, from doctors and nurses to cleaning staff, cafeteria workers, and nursing home aides. Giving healthcare workers and nursing home residents first dibs on vaccines is meant to protect those who have more exposure to the virus because of their jobs, and also those who are more likely to die from the disease. The CDC says healthcare workers are also big influencers on people's health decisions, so the example they set could help convince others down the line to get vaccines. Other high risk groups, like people with kidney and heart disease, or bus drivers and grocery store workers, or people 65 and older, will likely come next. The order in which they will be offered depend on the traits of each product, such as whether they've been tested and proven to work in certain populations. Other big factors include availability and distribution. Another big vulnerable group the CDC is looking to prioritize is low income and minority communities.
Told you.
They've been more likely to catch the coronavirus and to get very sick or die from it during the pandemic. Health researchers say it's because they're highly represented among essential workers and often live in crowded households. They spend hours in contact with strangers because they can't do their jobs from home. They also face discrimination and poor access to health care. Vaccine makers have also taken steps to ensure low income and minorities will be protected from COVID. They've been recruiting people of different races, ethnicities, and health conditions, so they'll have the data to show whether it's safe and effective in diverse populations. But setting vaccines aside for people is one thing, and getting them into their arms is another. That's a separate set of blueprints that health departments are working out.
Nah, I can't say too much now. I'm just gonna let them speak, and then we'll let them speak.
Community. And this, of course, goes hand in hand with healthcare access barriers, resulting in the very well documented higher diabetes, hypertension, and cancer rates in African Americans compared to white Americans. So it was certainly predictable that we would see the frequency of COVID 19 is disproportionately higher in African Americans, and death rates from COVID 19 are disproportionately higher in African Americans. Compounding the socio-demographics is the fact that African Americans have more exposures. Blacks are highly represented among hospital workers, delivery service industry, in public transportation. African Americans are more likely to live in housing environments that cannot support the social distancing policies. There's considerable and mounting evidence that shows that there are both genetic and, of course, biological differences when we think about various diseases when we compare blacks to whites in the U.S. Different types of cancer, heart disease, diabetes, hypertension, obesity, and even genetic diseases like sickle cell anemia. The disparities are real, and the differences are real. Our history, our genetic makeup, and the environment. All of those things sort of play a complex role in the reasons why we see these differences.
Uncle Tom. It sounds to me that it's multifactorial. Multifactorial. Say it's a one-two punch. There may be a genetic predisposition. Genetic predisposition. Some of these diseases, and they are exacerbated. Or fueled by environmental factors.
Absolutely.
Cosmos.
That's exactly what it is. So you have a group of people that are at higher risk of infection,
Activated.
but they also have an underlying biology that might put them at higher risk for a more advanced and aggressive disease course. And in this type of setting where there still isn't truly effective testing, and there definitely isn't any type of therapeutic or treatment, we're in big trouble. Many of the chronic diseases, right, that affect African Americans impact our immune and inflammatory systems. So if you have higher rates of these diseases in a population or community, the consequence of that is that those people will also have issues related to their immune system and their inflammatory systems.
So, are you saying basically that the immune systems generally of black and brown people are different than the immune systems of other people for genetic reasons?
Tell you. Certain DNA patterns are linked to African ancestry, other patterns are linked to European ancestry. These genetic patterns of DNA are also linked to other biologic mechanisms, such as immune response to different diseases. And we need to understand these in order to more comprehensively understand cancer pathogenesis, and it's likely also going to be important in understanding the best treatments for COVID. When we think about some of these diseases like cancer and heart disease, diabetes, obesity, we know that all of these things tend to influence an inflammatory response. So our immune system and our inflammatory system goes out of whack. And it's really interesting that one of the key features of COVID-19 aggressiveness is what we call a cytokine storm, where there's this dramatic inflammatory response that leads
where
to
the immune system goes into overdrive.
It goes into overdrive, and the bad thing is that it leads to tissue damage. It leads to all sorts of issues with our physiology, circulation. All of these things become affected and really makes our bodies more susceptible. Centuries of natural selection have made us who we are. But what we have to understand is that selection in one environment is beneficial. In a completely different environment, that same trait can now be detrimental. One example, the blacks who were put on the ships for the transatlantic slave trade that actually survived the trip, they had to retain water. And the physiology that is associated with that is high blood pressure. That natural selection that occurred has shaped African Americans in such a way that we have higher rates of hypertension. In that setting, it was beneficial. However, now being in the setting of being an American, that same trait now is detrimental. And of course, one of the things we know is that one of the primary conduits for the COVID-19 virus to get into cells is the ACE2 or the ACE2 receptor, which is also involved in hypertension. And we know African Americans have high rates of hypertension. And so the question can become, does that actually provide a better way, right, or in a more efficient way for the virus to actually affect these people?
Dr. Newman, can you talk about access to care?
Patients of color, and in particular African Americans, have socioeconomic disadvantages, such as poverty, results in a lower likelihood of receiving adequate care. More blacks are receiving care in the urban public hospitals, safety net hospitals. These hospitals have been disproportionately devastated by the costs of COVID medical care. And so it's become a real vicious cycle in terms of worsening care in populations that have greater needs.
We absolutely have to address these underlying social inequalities and socioeconomic issues that we know are playing probably a central role in infection rates and mortality.
Now I'm finna give you more proof that they know the sun is finna act up. All of this shit is about the golden race and the sun and the planetary alignments. Basically more than the sun, motherfucker, the sun, S-U-N. And this finna come from Mr. MB, Mr. MBB 333.
Going to come back and take a look at the specifics of that article here in just a moment. But first, here at the website, want to check out the Schumann resonance. Starting to see a little bit of activity increase in the Schumann data as we turn closer to the very active region on the Earth-facing side of the sun. We've been facing the active region for a couple of days now. That energy is starting to arrive. So look for an increase not only in the Schumann, but in overall geomagnetic activity around planet Earth. Hopping over to the Yellowstone supervolcano caldera. As you can see, another day at the office here at the caldera. Steady flow of small amounts of energy around the large caldera, which I would expect. Do you expect a little bit of movement from a supervolcano? After all, it is a supervolcano, but we've got some missing data once again at the lake and borehole seismos. There's also some missing data down here at the other borehole seismograph, and then some up here at this borehole. So we've got basically 4 seismographs with missing data. That could be something as simple as a mechanical glitch regarding the seismograph. I don't know, but this is the glitch. Why everybody talking about a glitch? Small energy being detected on most, if not all, of the seismographs on a daily basis. As long as we don't come over here and see them all lit up dark blue, I'd say we're in pretty good shape. Now, looking from the spacecraft, the Earth is right over here in the direct path of that very strong, that was a long duration, very strong C flare. Right there it is. That's Mercury, in case you're wondering what that bright spot is up there. That's Mercury. Here it is over here at the SOHO LASCO C3 instrument. There went the solar flare. Again, visible from SOHO. That is Mercury going behind the sun. That was a 360-degree halo. We'll see it again here at the SOHO LASCO C3. Not only did it go towards the Earth, went in all directions, headed towards planet Earth. Arrival time, literally any minute. We're over here at the Space Weather Prediction Center, and here you can see the solar flare come off of the sun. This is known as the Enlil spiral. Watch, you're going to see it come off very quickly. It was a long duration solar flare. This is Earth right here underneath my cursor. That should be arriving literally any hour. Once it does, we're going to see a big change in the estimated planetary K index. We will see some type of geomagnetic storm, whether it be a K3, maybe a K2, could even possibly be stronger, according to spaceweather.com. They're saying geomagnetic storm warning, it's coming. A coronal mass ejection, CME, is headed towards Earth, and a geomagnetic storm is possible when it arrives later today. That would be the 9th, or tomorrow on the 10th. NOAA forecasters expect the most intense disturbance to occur on the 10th, with peak levels near G3 levels. If that happens, auroras could be sighted in the United States as far south as Illinois and Oregon. Does it mean much more than that? No, not necessarily. CMEs are good for Earth as, in my humble opinion, they sweep away and deflect harmful cosmic rays that the Earth has been bombarded with lately due to the lack of sunspots and overall solar activity coming towards planet Earth. We need sunspots and solar activity. So, to me, in my humble opinion, this will be somewhat beneficial. Granted, we don't want to see a very large K9 geomagnetic storm with a X90 solar flare. We don't want to see things like that. But a general uptick in the solar activity, Earth-directed, I think it's going to be a good thing. It's going to deflect and keep away some of the more harmful cosmic rays that we have been seeing an increase in over the last couple of years. Once again, there's the Enlil spiral. You can see right there, contact green is planet Earth. Looking at the strongest energy on the 10th, arriving sometime on the 9th, probably within the next few hours.
All
I
through
would
the month.
say no later than midnight.
It's gonna be these all through the month.
It's moving at a pretty good pace, right there making contact.
Quick, my people. Now, I told you this is everything is regarding the sun and the people, children of the sun. Now, here it is right here. Universal law. They have to give you the truth and the lie all into one. I'm going to play this. This is from CNN News. Any video I use for awareness purposes. I am not a teacher. I am a beacon of light. I am one of many beacons of light that is walking the surface of this earth right now in a physical form. Now, I just want you to, I'm going to play this, and I'm going to intervene and give you my theory on it. Here you go.
Suffering from a range of lingering effects like extreme fatigue, shortness of breath, foggy memory, skin damage, gastrointestinal issues, balance issues. I've even heard.
Now, these are all the side effects that are happening. Long-term side effects of coronavirus. You see the top right here? Long-term side effects of coronavirus. Now, fatigue, shortness of breath. Now, fatigue and shortness of breath, you can put that shit all together as one. You understand? That's because the air is thinning out, the red iron oxide dust. Foggy thinking. What happened? What I told you. Their brains are shrinking and their skulls are getting bigger. This is the result of UVC radiation. UVC radiation is changing you on a micromolecule, from a micromolecule level, from the smallest cell in your body, from the inside out. UVC is changing everything here on this planet. Now, damage to heart, lungs, and kidneys, liver, and central nervous system. Your central nervous system is control your vessel. Now, the reason why this is bothering your central nervous system, again, you share 98% of your DNA with a violent, natural, violent animal. You understand? They share 98% of their DNA with a natural, violent animal. So while their brains are shrinking and their skulls are getting bigger, they are going to resort right back to who they naturally are. Then you have heart and lungs. This is where now listen, look at the heart thing, right, real quick. Heart and lungs, right? This is where they say black people is more highly affected, because you know why? We deal with the most stressful issues on this fucking planet. We are put in a position to survive. We are in survival mode. We have been in survival mode for the longest, since we allowed these people to manipulate us against each other. We are in survival mode. So you have, and then the foods that you eat, fucking bacon, all the greasy, high cholesterol shit, giving you high blood pressure, all kinds of heart diseases. And this is why they're saying that COVID-19 affect more black people than the other race, because of what you are putting inside of your vessel. This is the number one thing. What you are putting inside of your vessel. What you think is soul food is not soul food. It's actually death food, my people. Macaroni and cheese, fried fish. You're not supposed to eat none of that shit. You're supposed to eat like a fucking tree, to be honest with you. It's the sun and the water. Now, damage, we're going to go down here to damage. Let me explain something to you. You have no damage to your skin. Search up psychophotodermatitis. That right there, I did a video on that. Right now, this is what they are suffering from. I told you, if you take your cell phone, for example. If you plug your cell phone into a charger, and you leave it on its charge, on a charger, all motherfucking day, even when it says it's fully charged to 100%, don't you, when you unplug it or touch your phone, ain't your phone hot? Ain't it hot? Exactly, because it is constantly absorbing the energy, the charge. It's constantly absorbing. It don't have time to dispense it. Dispensing the energy from your cell phone, just using a cell phone, for example, when you unplug it and then you start using it, the phone actually start cooling down, because the battery now is cooling down. It is dispensing the charge that it had. This is what the colored people of this earth do. This is what black people do. This is what we do when it comes to the sun. Everyone else absorbs it. So that the sun they're not really killing them. The sun, they just genetically modified to the point where as though they can only absorb radiation, but they cannot dispense radiation. So they are absorbers. So now, because their bodies are breaking down, and it's taking them even longer to dispense the radiation, their skin damage is happening to them. They have black spots that's turning up on their skin is cracking.